Our next presenter is Dr. Sello Maboe. He is the Technical and Marketing Manager at Onderstepoort Biological Products, and he will do a presentation on bovine leukemia virus, EBL. Can it be a major silent threat to proper immune response in cattle? Dr. Sello, welcome, and you may start sharing your presentation.
Good morning, everyone. I just put up the first slide. I want to make sure that you've got the correct view as well.
It's visible, we can hear you, and we can see the slide. Thank you.
Okay, I'm going to switch on the video just for introductions. Good morning, everyone. Like Helene has mentioned, I'm a veterinarian and a technical and marketing manager for Onderstepoort Biological Products. But this project that I'm presenting for you today is actually as part of my postgraduate studies. So it was based on work that was done at UP as well. So I will be talking to you about the bovine leukemia virus, which a lot of you probably know already. I'm going to advance the slides, just starting with the outline. I'm going to try and cover as much as possible, but looking at the time as well, some of the things we'll probably just quickly go over them as well. And then the next slide there, we're talking about bovine leukemia virus, and you're probably wondering, what is the link if I put up a slide like this? Particularly for a day like this where we're talking dairy, I always like to use this demonstration to show that if you've chosen the right genetics, for example, you're not trying to milk Brahmans, for example, or even within the dairy breeds, you're happy with your choice, you've made a good choice, and you put them on a proper nutrition with the understanding that the nutrition will give you the outputs from these animals. And at the top there, we actually have a responsibility also to manage health. And unfortunately, in a lot of situations, we don't choose which diseases or which pathogens animals have to come across at any point in time. In fact, quite often they even have to deal with mixed infections as well. Sometimes we also notice even with minor health challenges, they will often overwhelm the immune system, especially in terms of multiple infections or mixed infections. You will notice sometimes, even if we're talking about the same disease, it may have a different impact on one farm as opposed to the next farm as well. So very important that we actually just explain and clarify where we actually fit in when we're looking at the health aspects as well. Then I'm going to also start with the terminology there, because when I was still lecturing as well, there was quite a lot of interchangeable use of the terms. For example, with our animals at Proof Plus that are BLV positive, they would quite often be mistakenly identified as leukosis animals. But BLV positive actually doesn't necessarily mean the animal has enzootic bovine leukosis, which is the end stage of the disease. In fact, you can actually draw a comparison between maybe HIV and AIDS, if that is a good example to use. So what I'm trying to demonstrate here is with BLV specifically, not all BLV positive animals will even progress to a clinical disease. A majority of the animals might even remain symptomless. But if you're working in an intensive production system, you probably will realize that quite often those subclinical infections, the ones that are nibbling away at a farmer's profits, sometimes without you even noticing or without even being able to really put your finger on it and say, this is actually what is costing me. So I've just put that up to clarify the terminology. There's a couple of terms that are used also, the lymphoma, the malignant lymphoma, the lymphosarcoma. The lymphosarcoma is actually the last clinical phase that we see in the diseases that start losing weight and developing this generalized swelling of lymph nodes and eventually succumb. There are other types of lymphosarcomas in animals, and they are not necessarily related to the bovine leukemia virus. There's a juvenile lymphosarcoma that has been identified in younger animals around 6 months and younger. Then you get the thymic lymphosarcoma, and then you've got also the cutaneous lymphosarcoma in 1 to 3 year old animals. The etiology itself, it's an exogenous oncogenic member of the Delta viridae, but I think more importantly for this specific discussion is to note that it is a retrovirus. And these are viruses that are well known for their immunosuppressive impact. Their immunosuppressive impact, I'm sorry. And HIV also comes to mind amongst retroviridae. So if you think about, or retroviruses, if you think about these viruses and the immunosuppressive impact, that's where, as scientists, you also worry about if animals carry this type of an infection, what else does it actually make them vulnerable to? Is it a disease? Because quite often amongst colleagues, we have this discussion and a debate about why do you want to waste so much time and resources on a disease that we may not even have a vaccine for example? But if you actually understand how the disease like this would impact your productivity or your profitability as a farmer, then you understand the importance of at least knowing something and knowing what you can do under your current circumstances as well. The virus itself has been known historically to occur in about 10 genotypes. And I came across a publication that was published in 2019 that there was actually an 11th one that's recently been found in China. And obviously just further proof that scientists are busy at work looking for these things and looking for answers. And the genotype 1 is actually the one that is widely distributed globally. We actually have genotype 1 in South Africa as well. In terms of the epidemiology of this disease, it can be transmitted vertically as well as horizontally. The vertical transmission is in utero. You can actually also have it take place at parturition. It has also been proven that it can be transmitted to uninfected calves through the ingestion of colostrum and milk. There's a couple of papers that we have actually put there as well in the presentation. And it's also highly probable that mastitic animals would carry higher amounts of virus in the milk if we were to compare, for example, with healthy animals. The virus has also been isolated in semen. In fact, a lot of the semen collection places, they would actually focus a lot on testing these bulls and actually separating them when they work with these animals, especially also considering the risk of transmission through fomites and things like that as well. The colostrum is actually quite a tricky one. There's a paper that I've also come across that still says administration of colostrum from BLV positive cows can still reduce the risk of infection in these calves, as opposed to if you were to deprive these calves colostrum altogether. So if you have maybe 100% prevalence on the farm and you have the infection all over the place and you don't have any other alternative source, you probably will be better off feeding these cows that colostrum than depriving them, especially keeping in mind that the colostrum will be containing antibodies for multiple other diseases that the cows will definitely benefit from. In terms of the horizontal transmission, it's mainly through a direct contact, whether it's blood, exudates, or tissues which enter through the broken skin. And this becomes actually quite important when we're doing our normal husbandry procedures on farms, things like dehorning, tattooing. In fact, probably at a much lower level at second year when we start discussions on biosecurity, we focus a lot on your equipments and how your tools and instruments can actually help propagate the disease. As you can imagine, if you're going to be vaccinating animals with a single needle, for example, even if the disease was going to spread eventually amongst the animals, the moment you walk in as a human being with a needle, you probably help transmit the disease within the herd even faster. The biting flies or the tabanid flies have also been implicated in the transmission of this disease. And this becomes very important when we start looking at control options. You realize that this is not an easy disease to deal with. Even if you plug certain holes, there'll always be a risk of other things going wrong, but that can never be an excuse to not do anything about a disease if you know you are at risk. It is also mentioned that you actually need only 1 microliter of blood from a persistently lymphocytic bovine to cause an infection. This basically means 1 microliter would be a drop of blood that may even be invisible to a naked eye. And this becomes even more important when we're having a discussion now amongst colleagues where you might get told, for example, when you do rectals, that you must change your glove as soon as you start seeing blood on it. And that is when we're talking to people that believe it's not always practical to be changing with every single animal. But the moment you start seeing blood, then you know that you can transmit diseases. But if you look at diseases like or infections like BLV, for example, you do not necessarily have to see blood, because that 1 microliter of blood is not going to be visible to your naked eye to help guide that decision. The distribution of the disease or the infection, it's in all continents except Antarctica. There's 22 European countries that have eradicated the disease, and hopefully they can keep the status, they can keep it like that, because that probably makes their lives also a lot easier when it comes to trade with these animals as well. There's about 7 countries that are not free of the disease. If we look at also other major dairy producing areas, if you look at the US map there, it's not very clear, but you can see this picture, picture of the world map I actually got from the OIE website. If you go onto the OIE website, you'll realize that there's more countries that have it than those that don't have it. A little bit of work that was done to determine the distribution in South Africa specifically. Dr. Sean Morris, Dr. Mohammed Mula, Dr. Rendani Ndou are some of the colleagues that did some work on the ground to determine how bad our situation may be. We may not necessarily be as far worse as some of the major dairying countries in the world. So some countries that do have the disease actually cannot coexist with the disease. You just need to manage the disease when you have it in the herd or in the country. There was also a paper that was published in 2020. These are researchers in the Western Cape, I think it was the University of Cape Town, that actually typed the two serotypes or genotypes that they found in South Africa to be the G1 as well as the G4. In terms of the pathogenesis, when the animal gets exposed to the virus, there's a couple of possibilities. You can get exposure to this infection or to this virus and you get no infection at all. And this is possibly attributable to the individual animal's ability to resist infection. Or you can get a latent carrier status where the animal, you can actually just pick up antibodies that there is an infection that is currently going on. You do also get a stage where the animals are permanently infected. They might have a benign lymphocytosis. And then you got at the bottom right of the quadrant there, the worst case scenario. And this would be like probably 10% or less of the animals that are infected with BLV that will progress to a malignant lymphosarcoma. This is the very clinical form of the disease that actually ends up with the animal being clinically sick.
Dr. Sello, you are muted.
I'm sorry about this. I'm working from home. My daughter just walked into my office. The malignant lymphosarcoma that I was referring to is the most common clinical form of the disease on the ground. And then, okay, here, these are the pictures of what the animals present with. This is a disease that we actually find in both beef and dairy animals, but it tends to be a lot more common and experienced in a dairy setup, purely because of the husbandry and the frequency that we handle these animals and a whole lot of things that happen to dairy animals that also increase the risk of exposure. They spend a lot more time also closer to each other, and we handle them a lot more often than we handle the dairy animals, for example. In terms of the breed, I've seen it personally a lot more in the Holstein breed in dairy than any other breed, but probably it might even just be a biased observations because it is the most predominant breed in the country, but I'm not sure if there is a specific breed susceptibility or increased susceptibility with the specific breed itself. This is the animals that were slaughtered. This actually pictures I got from Dr. Otto Creek in the Western Cape. So this is a manifestation. This is on a carcass. This was a herd that had to cull a few animals. And you'll see the generalized lymphadenopathies. You've got these huge lymph nodes even inside the animals at slaughter. In terms of the diagnosis, Serology has been done, especially for valuable animals, for example, where the farmers may want to export animals. They've always just taken blood and sent it to the OVI. I can't remember who else in the country does the serology testing. It is not always very practical. It's very expensive, the testing. Then there's agar gel immunodiffusion. There's ELISA. There's a bulk milk ELISA, and as well as PCR. And when I start discussing the work that we did with my colleague, the focus will be on the bulk milk, which was the first of its kind in the country that we did as well. And hopefully some of these tests, the cheaper tests, can be available in future in South Africa to help more farmers to at least understand and monitor the situation in their herds as well. In terms of the ability of this infection to cause immunosuppression, there's lots of papers that actually back it up. This specific one example that I pulled out here was the reduced IgG2 antibody production to the J5 vaccine in BLV infected cattle. J5 is an E. coli vaccine from Zoetis. And it was actually shown that animals that were infected with BLV did not respond so well to mastitis vaccination. And in fact, there is also papers that showed that they also have a higher incidence of mastitis. They've also seen hoof problems, gastroenteritis, as well as bronchitis in dairy herds as well. There's other paper here that is referring to even external parasites. So there's actually quite a lot. The next slide is actually just a summary of about 20 papers that were actually put in here that all show to different degrees the immunosuppressive impact of this disease as well. And there's more papers that are actually coming in. I haven't checked what the latest may even be, but the point that I'm trying to demonstrate here is when you're dealing with a silent disease like this, it definitely does cost farmers. It definitely has an economic impact on the dairy industry. It might be to varying degrees on individual farms, but there's no doubt about it. The estimated economic impact, this was a paper that I picked up from the US. It cost the producers about $285 million and about $240 million for consumers. And here they're referring basically just the clinical disease, the subclinical impact on cow longevity there was not even included in that calculation. In terms of the local research findings, on the UP repository, this poster is actually there. I couldn't blow it up big enough here to show. This is the work that Dr. Will Gretwick, myself, under the leadership of Prof. Peter Thompson, we did this work in South Africa where we collected bulk milk samples just to determine the level of herds that are infected with BLV. The initial project was meant to be the whole country, but we actually didn't get to do the whole country. We ended up with mostly the northern parts of the country that participated. We had a few herds also that came in from the Free State. And part of the project was also to identify the risk factors associated with the herd level BLV infection, because if one thinks about it, it's one thing to say you have a disease at a herd level, at the overall level, to say you're dealing with an infected herd. But as a farmer, you also want to know, yes, I have a bad situation here, but how bad is it? Is it 10% of the herd? Is it 70% of the herd? Is it 90% of the herd? Because if you have that kind of information, it also helps you to determine the control strategies. If, for example, you have only 5% of the population that's infected, it might be an easy decision to make a culling call, for example, on these animals and say get rid of them as quickly as possible, versus if you have 70%, nobody will wake up overnight and decide to get rid of 70% of a milking herd, for example. And then we look also at identifying factors associated with the within herd prevalence, the risk factors that could be seen there. So we had about bulk tank milk from about 155 dairy herds, Limpopo, Mpumalanga, Northwest Free State, basically the old Transvaal and the Free State, tested using the indirect ELISA there. There was a questionnaire that was used to collect data management factors and some herd-specific factors. There was logistic regression used to assess the risk factors for the BLV prevalence on the farm, multiple linear regression for the risk factor within herd prevalence there. But just to summarize this one, we always knew that we do have the disease in the country, but probably we also estimated that it could be at a very high prevalence. But if you don't have it on paper, if you haven't done the work, it's difficult to actually just go out and just say it for the sake of it or trust in your gut. So the work that was done here specifically, we had Mpumalanga that had the lowest prevalence of the tested herds at 77%. And then we had Gauteng at 97, and the rest of the participants there actually all had 100% of the samples positive for BLV infection. And like I said, here we're talking antibodies to the bovine leukemia virus, not necessarily meaning that the animals are sick. And in fact, the other thing that I need to mention here also is the disease has such a long incubation period in a way that some of the dairy cows may even be culled for other things before they even get an opportunity or they get to the clinical stage of the disease. And it's probably one of the reasons why the disease is actually just going through herds undetected, because cows will probably be culled, for example, for mastitis, unresolvable mastitis, or other reproduction-related issues before they even start exhibiting signs of leukemia itself. So what we actually concluded from this was the infection in South Africa is definitely widespread. Of the risk factors that were evaluated, it was actually shown that improved management of the calving process can actually limit the risk of infection. And that is why if one looks at a place like Proof Plus, for example, if some of the students have been to Proof Plus, you will see even on the ear tags, there's animals that get tested and they get tagged. And the ones that are positive will carry, I think they wear red tags, and the negative ones will wear green tags. And it is an attempt to actually try and manage the disease by keeping the negative animals negative. So they are managed separately from the positive herd as well. Okay, there's also a determination that the improved control of biting flies can also be a useful addition to a herd program in the control of this BLV. But if one thinks about it, some of the dairies do dip anyway. So maybe in their choice of dips, one could say, look for something that will also have efficacy against these flying parasites on animals as well, especially in seasons of very high fly activity. I've actually put in just a small discussion on zoonosis, but I don't want to dwell too much on the zoonotic aspect. The question for students, especially in the final year, would actually be to just do your own research, read up. There is a zoonotic potential in BLV, even though there's still conflicting papers out there. But I don't think that we can actually go out there and claim the disease to be a zoonotic disease yet until there's more evidence coming to the fore. But then again, when we talk about zoonotic diseases, quite often we focus on the common ones, the ones that we get reminded about every day. And sometimes we talk about certain diseases not being zoonotic, assuming that we're dealing with a healthy population. So in the context of BLV, for example, it's all nice and well to say to people that, no, it's actually not a zoonotic disease, but we actually may be talking a different story when we're dealing with a high burden or level of burden in a population that's already dealing with one or two other retroviral infections, for example. So that would be something that one takes into account. Another interesting discussion would quite often come while we were still students was a debate, for example, as to whether Babesia is a zoonotic or not. Yes, there are certain Babesias that may be zoonotic, that are definitely zoonotic. But in that context, the discussion was whether the normal Babesia that we get in dogs or in cattle, can it be zoonotic? And we say generally not, because it's never really been reported as a zoonosis. But we didn't actually take into account the fact that if you have an individual that for whatever reason, for example, gets splenectomized, we're not dealing with a normal human being that deals with diseases the way we deal with exposure to pathogens. So a splenectomized individual, for example, can actually fall victim to almost any animal diseases that can infect them. But specifically with BLV, if one looks at the literature, there was one paper where the virus was isolated from human breast tissue, even though it could not at the time be directly related to the disease. The question as a scientist should be, what does it want there? How did it get into a human being? How did it survive long enough to even be detected? And those are the kind of questions that, as difficult as and as scary as it may sound, that we need to ask ourselves definitely. Okay, again, whether or not it's proven to be a zoonotic, what could its role be in the etiopathogenesis of other infections, for example? Like we said, retroviruses are known to be immunosuppressive. So in their presence, how do actually animals or human beings even deal with other infections in their presence? We also had situations where we have debates like, okay, you want to know about the disease, now that you know, so what? And the question now is, we know we do have countries that are declared free of the disease. Can it actually be used as a potential technical barrier to trade? If you were to advise a farmer client of yours to go buy replacement heifers, would you even have a discussion about BLV? Would you keep quiet if you know there are herds that are actually known to be negative for BLV? Or would you keep quiet as a professional? You have a responsibility to protect your clients, your farmers, and eventually the national herd as well. If this were to become a known open zoonotic disease, for example, we also know that with these zoonotic diseases, disease control is easier achieved in the animal population than if we were to try and run around and curb the disease in humans. It's also cheaper because we can actually access the animals and treat them or prevent what if there is prevention than having to deal with sick individuals with limited number of hospitals for the kind of population that we have, for example. It's also very important to stay up to date with this type of an infection or a disease, especially the economic impact, because if it goes unmonitored, we might actually have bigger issues going forward as well. One also needs to understand the risk factors that heighten the within herd prevalence. For example, a very good example is if you know that you've tested your herd and you've separated your negative from your positive herds, then you actually can manage the risk of transmission when you're working with these animals as well. If you know you have a potentially positive herd, you know you have to use a new needle every time you vaccinate animals or you inject animals. It doesn't matter how time consuming it can be. You know that there is definitely a risk that you may even be knowingly transmit diseases to uninfected animals. The disease is neither state controlled nor notifiable. In other countries, it is actually a notifiable disease. So one would also have to understand that every country will have their own way of controlling and managing these diseases. There's economic considerations that are taken into account. And I would imagine for South Africa, for example, with everything that is doable and not doable with the disease, it probably did not feature in the top list of priorities, especially when we have other bigger headaches to deal with in terms of the state-controlled diseases as well. There's a few suggestions that actually came through in terms of management practices to minimize BLV transmission. One being the use of sterile hypodermic needles for each cow, and this is not necessarily specific for BLV. If you going to, I make an example with lumpy skin, for example. If as much as we tell people it may not always be practical when you're dealing with lots of animals to change needles every time, if you're going to go and vaccinate for lumpy skin in the middle of an outbreak, you are most likely going to be spreading the disease faster than the vaccine itself can actually kick in with a protective immunity to those animals as well. So make it a habit to understand and at least know your herd status if you go and take certain risks with certain procedures like injections as well. Clean and disinfect your blood contaminated equipment for dehorning, tattooing, supernumerary teeth removal, and other surgical procedures between animals. One interesting point that we probably could even debate at an academic level is I've been a big fan of dehorning using hot irons, but I also got to experience the use of a dehorning paste with all its risks and understanding that if people know how to handle it, it may actually be lessening the risk of disease transmission, considering that when you're dehorning with the paste, there's no blood, there's no other risks of disease transmission. But I know that it is actually a point of discussion at the livestock welfare committees. Probably maybe not the best thing on the welfare side, but we are still waiting to get further guidance on that going forward. But I found using that paste especially when you know how to use it and you know how to manage it, a lot cleaner than putting hot irons and sometimes having to actually debud and cut and have blood all over the place. Using of a clean or new and clean disinfected reproductive examination sleeves or even gloves, that makes a huge difference, especially when you're doing rectals, because when you do rectals, you inevitably going to damage a few capillaries in the rectum there, especially when one takes into account that some people will have bigger arms than others. Maybe in classes where it's mainly female, the risk will probably be a lot less than when you have big guys with big arms sticking their arms behind these animals as well. But when you know the status of the herd, you can also plan the order in which you work the animals on a farm. You can always at least plan to work these infected animals last in any procedures that you do as well. One could look at using artificial insemination exclusively, obviously with certified bulls that have been tested free of the disease. One could look at controlling of stable and other biting flies, minimizing contact between newborn calves and BLV positive cows, avoid feeding of unpasteurized colostrum from positive cows to newborn calves. I've come across actually a paper that showed that you can actually pasteurize this colostrum and manage the risk of transmission to calves as well. The segregation I've mentioned when we started, that's why we have the green and the red cows at Proof Plus, for example. But where feasible as well, farmers are actually encouraged to cull these animals because there's no cure for this disease. Once you have these animals with lymphocytosis already, you might as well get rid of them. They probably are not even your most productive animals at some point as well. If one considers the fact that when they start trickling into the clinical phase, they may eat not so well, or those that eat may not eat that efficiently to give you the desired outcome or the produce that you're looking for as well. A few questions to ponder, maybe for breeders also going forward. Can we invest in better genetics and other production efficiency enhancers to cushion the impact of this production limiting disease? I think that one is probably a question that's already answered. If one looks at over the last number of years, the improvement in efficiencies in dairy, we are getting less and less animals, but the productivity keeps going up. That means that we are doing something better. We are getting better genetics, but we probably could be doing even better than we are if these poor animals didn't have to enter a race with gumboots, for example. Maybe that's not a suitable comparison there, but we could, if we can, lighten the load on these animals to compete better and to give us even better out of, or to get better out of these animals as well. There is actually also a paper showing cattle that are carrying this specific allele that it said they can be used to break the chain in the transmission of BLV. They tend to be resistant to the infection. These specific animals that carry this allele, the LPL BOLA. And then we can also benefit more out of more phylogenetic analysis. Like I said, this Suzuki and Chapman researchers, they found the G1 and the G4. I think this was samples from the Eastern Cape, if I'm not mistaken. But if we could do a more countrywide phylogenetic analysis, and we know exactly not only that we have BLV, but what exactly are we dealing with? What genotypes have we got? Because the more the variants we have in the country, I suppose, the more the challenge it's going to be. Just like we carry on picking up new COVID variants as we go forward. I think if we have fewer variants, it might be easier to make some predictions and also help deal with the disease as well. What does it actually mean to our traditional vaccination programs? Is it enough, for example, to say a certain disease we've always been vaccinating heifers only once and it should be enough to cover them for a lifetime? Can we actually copy and paste that assumption in a herd that has a bovine leukemia virus? If a herd, for example, has been given, if a positive herd, a BLV positive herd, for example, has been given RB51, can it benefit from a second dose, for example? Or can we even increase the number of vaccinations to be safe with these animals? Is it possible that some of the diseases that we traditionally been sticking to set vaccination programs, these diseases are seeping through because there's other viruses that are also making holes in the immune system? And then definitely there's no question about the fact that we need to test more. I'm more interested also in how an immunosuppressive infection like this impacts animals' response to other vaccines as well. Take-home message for the students and producers alike. I like to use this bucket to show that when you're producing, there are always going to be leaks. The idea is to have that bucket refilling faster than the leaks, then we can have a sustainable agriculture. But where we can plug the holes, we need to plug them as much as possible. And this speaks to diseases that are preventable. Let's go all out and prevent diseases that we can prevent. Those that we don't have a solution in a bottle for, let's do everything we can to lighten the load on these animals. Let's know about them. If they need any specific type of care, then we know we can do that as well. This is a comment that was also made by the fellow researcher, Dr. Will Gratwick. And the question was whether the disease can be eradicated or even controlled in South Africa. And you will see that the challenge with the lack of identification and traceability is a challenge. The disease is so widespread, but herds that are free of the disease, they can actually be helped to maintain their status. To say, if you know that your animals do not have the disease, you will make an effort that if you ever buy replacement heifers, you will only go buy from someone that's got a negative tested herd. And you do not necessarily introduce diseases that you never had in your herd. But this also equally applies for farmers that have infected animals. At least working with this disease can also help you monitor. Is the situation improving, or what are you doing to, whatever you're trying to do to improve the situation, is it helping? Is it making a difference as well? I'm going to stop here and say thank you with a few acknowledgements to all the stakeholders that made some of this work possible. Thank you very much.
Thank you, Dr. Sello. You are the attendees, you're welcome to post your questions. Nico du Plessis, if I understand your question correct, you're asking, how do you do the BLV testing? Dr. Sello?
Okay. Currently, you can actually collect blood and send to the ARC OVI, I think. I think it will also depend on how many animals you are testing. If you're testing a few animals, you can still do bloods. The test that we used for bulk milk in South Africa, we got sponsorship from Zoetis. It was a company that they had just recently acquired that was selling these kits globally, but they were not yet commercialized in South Africa. But since then, I think there has been other service providers that have a similar type of bulk tank testing that should actually work out cheaper because it screens your herd at a bulk tank level. And if your bulk tank is negative, then you probably are negative. But when you get positive results from a bulk tank, then you can start narrowing down to individual animals. So this test kit also had bulk testing as well as individual animals that you could buy a test kit for. So this we actually didn't buy, it was sponsored for the project. But we could possibly make contact with Zoetis and see if the symbiotics kits are commercially available in South Africa.
Okay, there's no other questions. You're welcome to post them or to raise your hand. Dr. Sello, we can just wait a bit. Dr. Martin van der Leek. And there's another question. Okay, we'll first give Dr. Martin and then the other guest. Okay, we've got some hands here. First, Dr. Martin.
All right. Hi, Sello.
Hi, Doc.
We earlier this week we spoke about the longevity of cows, and certainly in South Africa that's longer than it would be in TMR herd in the USA. And it's just interesting that if you're looking at a dairy cow, by the time they start showing disease, they're already off the farm. So it's less of a problem relatively. And I would also say that it's classically a problem in purebred herds, where they also keep the animals for longer. Do you have a comment on that?
Yes, Doc. That is actually a very good point. I mentioned in the discussion that the age at culling, the average culling time for our cows makes it possible for these diseases to linger undetected. So when it comes to clinical disease, a lot of them will disappear long before they even start developing the clinical disease. The question on the subclinical infection could still be what economic impact at that level they would cause. And my experience has also been that an infection like that will definitely have varying impacts on various farms. You do get a farm that will coexist with a disease for many, many years, and you will get a disease that, you will get a farm that has been living with a disease for many years and suddenly lights go off. I know a specific example of a farm where the disease has always been there at an acceptable prevalence, and one day out of the blue, there were suddenly lots of animals that went down with clinical disease. And we don't know, we can't speculate on what could have happened on that specific farm. But even the subclinical one, it's always going to be a hidden bomb that can explode anytime that one is sitting on. But yes, I agree with you 100% that the animals may disappear before they even become a problem for the farmer.
Thanks, Sello.
Okay, our next guest who would like to ask a question, you can go ahead. Who also raised his hand.
Yes.
No.
Good morning, Dr. Maboe and everybody and all the participants. Dr. Sello, thank you for the eye-opening presentation, especially with the BLV and the undetectability of it. that is going unnoticed. With so many heads that are testing 100%, even though it was not tested throughout the country, is there a need to overhaul the import and export protocols for milk and livestock as such? And my second question, it will be, with the use of automatic syringes and needles, that is a common practice in most farms. Would you say that is a no practice, or should we apply a no policy to that kind of practice? Thank you.
Okay. Thanks. With regards to import and export protocols, I'm not sure. I would imagine that people that work in import-export control and that deal with trade relations will probably tell you that you cannot ask an importing or an exporting country for a disease status that you yourself cannot maintain. For example, I don't know if we are able to say you cannot import an animal from a country that has BLV if we have BLV ourselves, for example. But I know, for example, when I started, I mentioned that there are people that have been exporting animals and they have been tested, and those that test positive were allowed to be exported or imported into other countries that trade with South Africa. So every country will have its own requirements, but the mere fact that some countries request us to test animals that are being sent to them, it just means they're not just testing for the sake of it, that positive animals will not be accepted. So even if it's not international trade, even locally, if your potential customers start asking for BLV results, yes, if we have 100% prevalence in the country, then you don't have a choice. If you need replacement animals, you have to buy what's available. But if there are farms that are negative and they are known, they can actually market their replacement heifers as such. It's up to the market to determine if they have preference for those and how much they're willing to pay for them. Obviously, it becomes an economic decision there. Automatic syringes, I'm not so sure if I understood your question correctly there, but I'm not going to say anything bad about automatic syringes. They are being used currently. They are super efficient, super fast. But whether the syringe is automatic or not, if you're not going to change your needles and you don't know the disease status of a farm, there's always a risk. So with or without an automatic syringe, the disease transmission risk will be there if you're not changing your needles, especially with a head of an unknown status. Can be any disease.
Thank you, Dr. Sello. Our next question is by Mr. Luke Bauer.
Good morning, Dr. Maboe. How are you, sir?
I'm good in you.
Thank you, sir. I just wanted to ask you, sir, I had a bit of a case with a friend a while back. I was assisting him on his feedlots, just with the feeding and that. And then a bull that's had to be centered around the lymphatic nodes, but we couldn't find any bacterial reason that he could have developed that. But it seemed that two of his pen mates in the same test pen were Bonsmara bulls, also 8 months old. They had significant swelling around the hooves. No hoof damage whatsoever, but the coronary line itself, there seemed to be significant swelling around that. Is it possible that he contracted a bacterial infection that led to him developing these symptoms? Or is it that he maybe had juvenile BLV, that having goblet infection, it triggered that?
Mr. Bauer, I must apologize. You broke up a bit. If you don't mind repeating the question for me.
No problem, doctor. We had an 8-month-old Holstein bull that was under feedlot conditions. We had 16 test pens, and he was in one of the test pens that had 2 other individuals that were affected by hoof problems. When we investigated this, we found that the mechanical damage to the hooves, but the 2 other individuals, which were born Samara bulls, had significant swelling around the coronary lines in the hooves, whereas the Holstein bull had developed an entire inflammation of the left-hand side of his body, especially centered around the lymph nodes. Would this be a more bacterial issue, or could it be they had juvenile bovine leukemia virus and it was triggered by a slight infection?
Yeah, that's a difficult one. In terms of bovine leukemia in an 8-month-old, definitely not. But swelling of lymph nodes is when a body reacts to an infection, and it could basically be anything, especially we've seen it a lot more with viral diseases as well. It can absolutely be anything. So it's going to be very difficult to speculate about it in this specific case. And also the juvenile lymphosarcoma, it is so rare that chances are if it is it, then it will be one of those very, very rare occurrences.
Thank you very much, Doctor. Could I send you a bit more of a case history with what steps the veterinarian took and to see if we could identify it? Because he did eventually recover after about 3 weeks.
That will be an interesting one for me. Yes, please.
Thank you, Doctor.
Thank you, Mr. Bauer. Dr. Sello, Nico du Plessis also asked, can you test the herd one by one to see which cow got the disease? And do you need to cull that animal?
Okay. My suggestion is always start at the herd level, take the bulk milk and determine if this test that we did was so sensitive it could pick up 1 animal in 250 animals in a bulk tank. So if your bulk samples let's say you have maybe 250 or less animals in that bulk tank, if they are negative, there's a very good chance that your individual animals will be negative or still incubating the disease. So if you do the bulk testing and the animals are all clean, there's no need to test individual animals. However, if you test the bulk sample and you get a reaction, then you definitely want to know how bad the reaction is within the herd. Is it, if you have 50 animals, is it 40 animals? Is it 5? Is it 2? Because then if you have 2 animals out of 50, it's an easy culling decision that you can make. But if you have 25 out of 50 animals that are infected, for as long as there's nothing wrong with the milk from that animal, there's no reason for you to rush to cull it, but at least identify it and know it, because then you will know every time you do any procedures on the farm that animal will be a disease risk transmission to other animals that are not infected. And what I've actually seen, if it is even physically possible to separate the animals, I've seen some people keep them on completely separate farms, have completely separate people working with these animals. Then the chances of even accidents happening then becomes even easier to minimize.
Thank you, Dr. Sello, for your presentation.